everyone. My name is Craig Andrade. I'm the Associate Dean of Public Health Practice at BU School of Public Health and Director of the Activist Lab.
Hi, I'm Emily. I'm the Assistant Director of the Activist Lab. And we're so excited to be talking to you today. And we're thrilled that you're considering BU School of Public Health as part of your next step in your career. I think Craig will agree with me that your timing couldn't be more perfect.
I could not agree more. We all recognize for the last 2 years, we've been through a global pandemic where all of us have been stressed and stretched in all kinds of ways, also in the midst of an economic downturn, racial reckoning in all kinds of ways, and social injustice that has been exposed in ways that we could have never imagined, recognizing the kind of inequities in our work, in our life, and finding ways to understand that there have been people marginalized and undone, and public health is in front and center of all of this. So it is a perfect time for people to come to the field of public health.
Absolutely. And in the Activist Lab, our passion is to work with students to figure out not just the knowledge, the why the world needs to change, but the how. We get really excited working with students. We want to know, what are the public health issues that keep you up at night? And what are the ideas and solutions and innovations that wake you up in the morning? And so that's what we do in the Activist Lab. We work with students in this laboratory setting to think about how your unique set of skills and experiences can change the world.
Truth is that you have so much of what you need to become a positive, impactful public health practitioner. Your life experience, what you've been through over the last decade or so, has taught you things that no one else knows in a way from your perspective. And so it's critical that you, at this moment in time, bring not just your head, but your heart as well. And so given what we've seen, the inequities, the disparities, the challenges in our system that have left some people behind, here is where we think advocacy and activism are core public health competencies. And so we work with other faculty, staff, and students, community partners as well, to be sure that we can find ways to collaborate across competencies and bring that head and heart together at the same time.
We have a couple of really exciting programs happening in the Activist Lab right now that I think you'll enjoy. One of them is called our Activist Clinics, where we bring subject matter experts. Sometimes it's Craig or I, sometimes it's a student or a community partner into campus to focus on one specific skill that we think is important to public health advocacy. And we really drill down into that skill for about 50 minutes. So that way our students and also our faculty and staff can learn something new, explore a new topic, and build their public health advocacy toolkit. And one of the other programs that I really love is our Meet and Greet series, where we get to bring that community aspect of public health into our campus. Last semester, we brought in folks who work in the LGBTQ community, thinking about advocating for their health and wellness. And it was a really great opportunity for our staff, our students to think about practicum projects, research questions, and build a whole bunch of new connections.
Yeah, and this semester we'll be bringing a whole bunch of communities of color to campus in ways that help us understand how can we bring the experience of those communities, whether they be Black, Latinx, Asian, Pacific Islanders, and others, to finding ways to understand the community better, to further partner in more authentic ways, and be sure that their voice is being heard in a way that can be integrated in all the work that we do as public health practitioners. Another consideration is our impact grants, where we really do bring the lab and our Activist Lab. Students can bring ideas that they have around any number of things, from criminal justice reform to enforcing and supporting better housing initiatives and food insecurity mechanisms to address that. So students in the past have brought these kinds of mini grants in ways that allow them to support the work of a local or a national agency or even an international agency, amplify their work through any number of ways. One group has found a way to create a survey for transgender adults so that those community health centers better know what those communities need and how to serve them much better.
So there's a lot of great stuff going on in the Activist Lab already, and we can't wait to learn more about you and what you're interested in and the next steps that we'll take to help you on your path to being a public health change agent.
Absolutely. And as I started this conversation, I spoke to the places we've been, the challenges we've faced in the COVID-19 pandemic, in the racial reckoning, in the disparities that we've seen, in the systems that we see need to be refined, and that you bring so much to the table. Even before you start your classes, your life experience speaks to the experience of the communities that we partner with. And so we invite you to come to the School of Public Health here at Boston University and find your passion. Recognize that what you bring, the perspective you have, the experience you've gone through, and what you are looking to focus on in the world is just what the world is waiting for. I use those words, that the world is waiting for you, because there is an urgency. I look forward to seeing you here on campus, and I can't wait to see the change that you bring.